Welcome back to the Chatty Vets pod. I'm Brendan.
And I'm Charlotte. Thank you for tuning in.
Welcome to our third podcast of July, our next 2 Week Takedown episode.
So this is where we aim to bring you up to date with all the latest news and products in the UK from the last few weeks.
We hope you loved the bonus episode last week with Matt Gurney as much as we enjoyed interviewing him. Hopefully we'll get him on the podcast again at some point, as we had so many more questions to ask him.
Yeah, definitely. And we loved last week. But remember, if you have any comments or you want to get in touch about anything we did discuss with Matt last week, catch us on WhatsApp, DM us on socials, or contact us via our blog on our website. All the links are on our socials if you do want to get in touch.
And remember, rate us on Spotify or Apple Podcasts. We'd love to get more lovely people like you listening. Before we start our usual spiel about what we're chatting about today, we wanted to update you on the massive thing that's happened last week. We held our first ever CPD event.
We did. It was a bit scary, but it was an absolute blast. And we hope everyone that attended enjoyed it just as much as we did.
And if you missed out this time, don't panic. We've now launched our Chatty Vet CPD library. So every CPD session we run, we will be recording, and the recording will be available to purchase after the event on the CPD library. It's obviously nowhere near as fun as being able to come to the live event, interact and ask questions. But it's a great option for those of us with busy lives who might find it tricky to attend on the day. Right now, you will find the new grad, recent grad CPD. It's 7 hours. There's 4 recordings in total. There's course notes. There's all the slides. So that's all on there. It's £60 for 30-day access. So if you're a new or recent grad, people loved it. So yeah, you can give it a blast.
Yeah, absolutely. So if you did miss it and you feel like you've missed out, then don't worry. You haven't missed out too much. So pop to the website, links in the show notes, and you can have a little look back at what the day brought to us. Also, some big news. We're planning on starting a really exciting new CPD stream in a couple of months' time. So we're going to be focusing more on how to approach emergency cases in general practice. So keep your eyes peeled for a little bit more information to come.
Excellent. Exciting stuff. So anyway, today we're going to be covering a multitude of random topics, from neutering controversies with cats, rabbits and guinea pigs, vitamin D, rodenticide poisoning, not the usual one, vitamin D. Mm-hmm. And I've had 2 cases of these in the last month. And also how you can get involved with some overseas charity work as an RVN, along with much more.
Yeah, so hopefully there's lots and lots of fun stuff to go through. But just before that, though, we wanted to take a second to say a massive thank you again to everyone who has been messaging in with lovely comments about the podcast and giving us ideas for topics to cover, opinions on topics we've already discussed, etc. So we wanted to say a few thank yous now.
Yeah, we got a lovely message from Katrin. She was sitting our finals and wanted to thank us from the bottom of her heart for the podcast. She said they've been incredibly informative. Yeah. Barbara on socials, a nurse in Ireland. Been a nurse for the last 22 years and listening.
Yeah. And Sally, GP vet in Scotland, she said she was loving the pods and she reached out to us on WhatsApp. So, but other people, please do the same. We love reading those messages.
Did you feel like slightly, what's the word? Where we had this message from Pet Vet in Warrington and they said that they loved the pods and can we come and be involved in their open day or something like that? And it was like, oh my God. It was like, wow, it felt like we were very famous.
Yeah. We're not at all, but yeah, that was Georgia, I think. So thank you for listening. Thank you for messaging us in. It's actually really so nice to hear that if someone's listening and then the whole practice ends up listening and then they're all chatting about what we talk about. It's the whole premise of what we wanted to do here: generate discussion, generate support. Yeah, we're really, really pleased that you got in touch. So thank you so much for getting in touch with us. And I think we also had lovely Kira as well, a final year vet student who contacted us on WhatsApp. Anyone that does listen, please do share it around with your vet friends and your vet community. The more listeners we have, the more content we can make for you. So thank you very much to those of you that already got in touch. We really appreciate it. Anyway, before we move on, we wanted to have a bit more of a chat around one of the other comments we've had recently. I think we had one from Abigail, wasn't it?
Yeah, this isn't that recent, is it? It feels like it may be 6 to 8 weeks ago, but with everything else that's been going on. But it was such a good question. I wanted to reply to her on social, and it took me like a week because it was such a big question. But she was talking about essentially whether to work in GP world or whether to go down the specialist route, and essentially the pros and cons of both, would you say, and how that matches with your personality work work style, something like that.
Yeah, and also why we've chosen to do what we've done. You know, what makes you choose a route between GP work and being a specialist? And it can be really difficult, can't it? It's like asking someone to decide what they want to do when they're 18. There's so many opportunities out there, but how are you supposed to make a decision? And I think I'm very much a believer of, don't go into your first year as a vet having a really clear set idea of exactly what you're going to do with your career, because it can completely change. You know, you might be working for 6 months as a GP vet, fall in love with GP work and realize you don't ever want to do anything else. Or you might get into it, think, this isn't for me, I'm fed up of itchy skin and bad ears, and you want to be a cardiologist. And sometimes is like a one particular case that can just completely change your mind on how you want to deal with things in future. So I think just go with it. Your experience and the cases that you see will help sort of guide you as to where you want to get with your career, would you say?
Yeah, I would also go as far as to say, I don't think you can know until you've done a few years. And just because let's say you're having a really hard time in general practice, just be aware that could be because of the support around you, the practice you're working, even if you've been in 3 different practices. It could be those are the 3 practices that just do not suit you.
Mm.
Also, I think you change your needs over your career. So I think it's quite good to keep an open mind, try and keep I know it's impossible to keep a foot in both camps, but to some extent, keep your mind open to, maybe you're doing a bit of a certificate. So you've got that option if you wanted to go further into specialism. Try and be flexible, I think, where you can, but also work hard to address what isn't working for you. To try and make it work for you, because oftentimes it's not you, but it's the environment you're in. And you can sometimes make some changes to everything around you to make things work better for you.
Yeah, definitely. And everyone's different. But for me, especially, I thought about specialising at one point. So I very nearly thought about potentially being a criticalist. But I decided I was at the point in my life and the point in my career where I just didn't want to go. It feels like you're going backwards sometimes going into an internship after you've been working sole charge for a while. So for me, it wasn't worth it to go back to doing a rotating and then a discipline specific internship and then going on to your actual proper specialism. It just didn't feel the right move for me. But then someone that's 21 and is fresh out of uni and then does a couple of years, that might be the point in your life where you might think, great, I'm going to get stuck in and really work hard so that it pays off. And then I spend 20 years doing a specialism that I love. Remember, like when we spoke to Bradley Viner, there is absolutely nothing wrong with being a GP vet your whole career as well. It is a specialism in itself. It's just sometimes not deemed as one, but it is. You can be an incredible general practice vet. And I would almost go as far to say is that GP vets, I think, have the biggest effect on clients and their pets versus any other type of vet out there, because we see them the most. We have the most impact on their overall life. Don't feel like you have to make any decisions quickly. There's loads of time. There's so much opportunity out there for you.
Yeah, I'd back that up. And do you know what? There's no easy route. It's tough, isn't it? It's tough whichever you choose. You just as you have to be really determined and tough to get onto the vet course and through the vet course. And you could apply that again for the next 10 years, I think, couldn't you?
Yeah.
It's not an easy,
definitely.
It's never going to be easy.
No.
Yeah. I mean, with doing a GP vet, you've got more options for practice ownership nowadays, haven't you? So you've got that, and then you can work anywhere in terms of, which can be quite important as well. So it's nice having a foot in both camps if you can.
Exactly. And remember as well, we do actually have that link to GVC, so Global Veterinary Careers. So if anybody is looking to potentially jump ship and explore a new career option or wanting to see what's out there, or maybe even think about going abroad, you have a little look at the link on our socials, and I'll put it in the show notes again today. So if you are looking for a new career change, have a chat to them. They're amazing. We have a little link specifically through them. And if you let them know that you've come through us, they'll treat you really well. Not that they wouldn't anyway, but have a little check because they're fantastic. So you can have a see if you are looking to sort of jump ship and find something different, then have a little chat to GVC. So
absolutely.
Okay, so moving on a little bit, we chatted about some neutering controversies in dogs in a previous episode a few weeks ago, bringing up whether we maybe should be considering neutering at all in some of our pets, whether we should neuter at the timings of when we should neuter, the pros and cons. But what we didn't discuss, because we didn't have time in that episode, is what we should be recommending in other animals. So our cats, rabbits, or furries. And I think everybody probably recommends something very slightly different, but I feel like cats is maybe the one that everyone's doing the most similar. Would you say?
I've got a completely unevidence-based aesthetic thing. I just like, when you get the rescue toms and they're
and the
so
chunky
lovely.
cheeks.
Yeah, I love them. And they've got this inner confidence, so they express their affection for you much more strongly.
Mm.
So I really like them. So I'm really bad, but with responsible owners, I'll say, I'll just keep them in another 2 or 3 months as well, just to let them get a little bit more male, if you like that, like big cheeks, and they're a bit more affectionate and confident.
Yeah.
And I've always got that thing at the back of my mind. That's how nature intended them to be. The more less we mess with them, the healthier they'll be.
Yeah.
So, yeah, I'm bad. I do that. And the people always talk about spraying, but I find spraying is an issue with stress. And if they're not stressed, if there's other cats coming, trying to enter the house, or lots of changes in house personnel, then they might have stress. You might have spraying. But if you have a nice low stress environment, you can give it 2 or 3 months and try and extend it. But that's my terrible way of doing things.
Yeah. I guess it depends where you work as well and the type of clients you have. I mean, a lot of the clients that I've seen, I wouldn't trust to be that responsible, and they'll be like, oh, they can go out during the day, they'll be fine, and then you have hundreds of cats in the neighborhood that are getting pregnant. So I think it's if you know you've got a really responsible owner that is going to say no, they're not going to go outside until they are neutered, then fine. But I think that now sort of the current evidence out there for cats basically says that, unlike in dogs, where we now know that there's definitely a benefit to delaying neutering and doing it to the point where they've gone through skeletal maturity, we don't have that evidence in cats. There's nothing out there that says that doing it before puberty is a bad thing. And so actually the majority of organisations out there, like iCat Care, etc., are promoting still before puberty, so around 4 to 5 months of age. So it's the ones that aren't intended for breeding anyway. So, and obviously, we know that the evidence out there for preventing pregnancies, preventing pyometra and ovarian disease, reducing mammary tumour risk, but also reducing the risk of things like roaming, fighting. There is some evidence about urine spraying, even though you have said that it does link to stress as well. That evidence is still fairly strong. You get the reduced cat bite abscess risk, etc. So, and there are some studies out there that say that there is increased longevity of cats that are neutered sort of at that point. I think that is very different to our dogs. And I don't think you'd be wrong for saying that pretty much I generally say any cat, roughly, unless there's anything else specific going on, around 4 months / when they hit 2 kilos is when I'm recommending neutering. But I don't know if that's the same with you.
I'm a bit different. I don't know. Where am I coming from? Maybe I need to. It's really good that you brought that up, because if all those groups are saying it, that's important to say. I don't know. I just do 6 months. Where I've got a boy and a girl cat, kittens, obviously from the same litter, I will go 5 months, whatever. We'll go early because of the issue with the boy and the girl mating. But in other situations, 6 months, and with boys, try and give it another month or 2. Oh my gosh, I don't know. I'm not saying that this is the right way to do it. I'm just saying that's what I say. And you know what I said earlier, my comment about interfering as little as possible. Let's let them have their natural hormones for growth and development, because those natural hormones, I say to clients, they're not just involved in puberty and reproduction. They're having profound effects on the musculoskeletal development. So, if we can interfere as less as possible, but most of us don't want to have a female cat coming into season. So 6 months seems like a really sensible way to do it. Also, you're not letting them out until the 6 months, in my opinion. I wouldn't let a cat out until they're 6 months old, because they're not clever enough to handle being out and about yet. So it just feels like it's been forever and an age where we said 6 months for those reasons. And I still think that's good advice.
Yeah. Yeah, I don't know. Maybe it's from a background, because I did a bit of charity work and stuff as well. So I was just used to neutering everything at really young. But I think it's, I don't know, another ethical debate as well. I mean, I've spayed a lot of cats that have been pregnant, for the point of, we've got so many rescue centres in the UK that are completely overrun with cats that we never find homes for, that is sort of trying to help with the problem of that. And I know people will have an opinion on that in itself. But I just think, well, if you can't guarantee that people aren't going to let them out before they neuter them, and you're not going to be adding to that problem, and there's no evidence at the moment that says that it's worse for the animal to neuter them at 4 months rather than 6 or 7 months, then for me it just makes sense. Plus everything's so much smaller, and you think like a cat castrate, if you've got teeny tiny testicles and the blood vessels are so tiny, versus like a really chunky tom, those ones that have been roaming stray for like 3 years, and then you go to castrate them and you're like, oh my god, they're huge. So it's a very different surgery, isn't it then?
It's easy, much easier. And the girls are easier at 4 months, I noticed.
Exactly, yeah.
When you said there's no evidence, is that there's just no evidence one way or other? Is that what you're saying? Or is it that they've looked and there's no evidence of harm?
So between 4 and 6, maybe not quite so much, but early neutering definitely before 6 months of age, there is definitely evidence out there. So we obviously know that there's evidence that says that neutering reduces or eliminates pyometra, reduces mammary carcinoma risk, etc. But there's actually a paper that says that early spaying before 6 months of age reduces mammary carcinoma risk by 91% compared with intact queens. So early neutering has a massive impact on reducing mammary cancer risk in female cats. There's also another paper that they're like comparative studies, and one of them looked at 1,600 or so shelter cats followed up to about 11 years, and it compared neutering before 5.5 months old versus later on, and it found that there was no increase in mortality, serious medical diseases, urinary tract disease, orthopedic disease, and there was also less urine spraying, less sexual behaviour, fewer abscesses, and less aggression to vets by neutering at that early age. So I think there definitely is the evidence out there to say that early neutering is the way to be going. And there was another study by Oliveira Martins et al. In 2023. And it looks like it was like a retrospective study that compared less than 4 months of age versus more than or equal to about 6 months of age. And they looked at obesity, urinary disease, joint disease, behavior, and there was no statistically significant differences between the groups. But the study was fairly small, about 105 animals or so. So I don't know. I think there is definitely the evidence out there. I think whether there's that much evidence to say between 4 and 6 months, like the difference between that 2 months gap. But I think there is the evidence out there to say that early neutering seems to be the way to go in cats. So
yeah, I think you've converted me. I'm going to go early neutering. I think my only hesitation would be boys. Just they look a bit girly, don't they? I don't know. I don't feel like that's right. I don't know.
They are. I do love a tomcat with big chunky cheeks, and they're so gorgeous, aren't they?
But their temperament as well, isn't it? It goes beyond.
Yeah.
They've got this kind of roguish, lovable kind of charm, haven't they?
Yeah,
there you go. Well, yeah, no, I think you've got me on that. And I think I will start do you know what? I love neutering. I cat spays at 4 months as well. I think they're really easy compared to even easier than 6 months, aren't they?
And they just heal so fast as well. They're just so, they just heal so quickly. So, but yeah. Now, moving on to a slightly different animal. What do you do with rabbits? What do you suggest to rabbit owners?
Okay. Well, look, I know everyone's going to go on about the blooming uterine adenocarcinomas and that basically every single female rabbit in the whole world gets this. It's just, I don't know. Why don't I bloody diagnose it then? I know people have been saying this for 20, 30 years. Do you, I mean, hand on heart, have you had a female rabbit with a uterine adenocarcinoma?
I've had one, I think. I have had one.
But,
okay. Yeah, I have had one. But I mean, considering how many rabbits I've seen. But then I don't know whether because you think we see a lot of older, they're not actually old, but a lot of rabbits that people have had for a long time, they come in and we know that they're in ileus and they're just not well. The owner doesn't really have any money or doesn't want to spend that much money and they end up getting put to sleep. But how many of those have uterine adenocarcinomas that just never get diagnosed? I think that, there is definitely evidence out there that says that spaying obviously gets rid of / dramatically reduces the risk. But I think maybe the studies that were out there did overestimate how common it was. But I do think it's still something that's worth discussing with clients. But the big thing that I always talk with any small furry owner about is obviously the GA risk, because it's so much higher than your dogs and cats. And I also think it's very clinician dependent. Like if you are a vet that is really confident with your anesthetic protocol in rabbits, you can intubate them, and you have a nurse that is really happy monitoring small furries, completely different situation. If you've never done a rabbit GA before and nobody in your practice is that confident with them, if you can't intubate them, I'd be having a discussion with your owners about whether it's worth it, because I think that the difference for me between anesthetic risk between intubating a rabbit and not intubating is huge, because as soon as you get any apnea, you're buggered. Whereas if you can intubate, it's so much easier to deal with any eventuality that happens, isn't it?
Do you know what? Have you not used the V-gels?
Do you know what? I don't like them. I just find they move all the time. I intubate them. I don't like them.
Right.
Yeah.
Well, we used to use them back in Bromley at Laurel's, and I really liked them, actually, overall. I take your point that, now look, we stopped using them because, it sounds really terrible now, but we didn't have capnography and it was a real annoyance. But now I've got capnography again, I'd be really tempted to go back to V-gels. So then I've got that security of knowing, is it still doing the job it's meant to be doing? But for the short periods of time that we were using them, it was just like, this feels too easy. But yeah, but were you finding they wouldn't? It was not. You were using them with capnography as well.
I mean, I used to blind intubate bunnies, and I think it's because I got taught to do it in my first practice. So that's how I was doing it. So I think because I got taught to start off with to blind intubate, I was just always doing that. So I never really used them. But now if I try to use them, they really irritate me. I'm like, oh, just get me an ET tube. It just irritates me. And I think that we've got so much more ability to intubate in practice now. You know, you can use otoscopes, you can use those little rhinoscopes to visualize the larynx and then put an ET tube in. I just think we should be practicing to try and do it. If you get them in sternal, really elevate and extend that neck up, it is easier to do than you think it is, especially if you've got a long otoscope head or a small rhinoscope where you can actually see where you're going. I think it's really worth trying, because if you've got that ET tube in, you can IPPV, you can do whatever you need and you know it's not going to move, especially for dentals. Imagine trying that you can't do a dental with a V-gel, whereas if you've got an ET tube in, great. So I don't know. That's one of my big things for, I guess, is as to how risky rabbit GAs are. If you've got an ET tube in, I feel a lot happier.
Yeah, I would I'd intubate rabbits, but I'd find the littler rabbits, of which many are little. They were the ones I found really difficult. I'd like 2 kilos, great, intubate that.
Yeah.
1.5 or 1.25 kilos, which a lot of rabbits are. I used to find them pretty tough.
Yeah, but I think it's easier to visualize the larynx than you think it is. So I think if you can use an instrument to visualize it and then thread your ET tube over it, it makes it a hell of a lot easier. So that's one way that I would really consider going if you're unsure.
What were you doing? Because we used to have what actually was a supremely safe triple combo, and we used to use it, and we didn't have any anaesthetic issues. Were you inducing them with propofol? Because obviously you want that higher depth for intubation sometimes.
No, so often not. So generally, in rabbits, I haven't done a rabbit spay in ages, but I think generally what I would do is give them like their gut stasis meds and opioids and stuff. And then I think IV so I'd get a IV in the marginal ear vein. And then I think I used to give medetomidine and ketamine, and that would be my induction. And I'd give a slightly smaller dose and I could top it up if I need to. And then I'd intubate on that. And it seemed to work really well.
When I go back to my rabbit space in the past, the monitoring is like, are they on the table and are they not moving? It did feel pretty bad.
One thing that I find really helps is, I mean, obviously if you've got an ET tube in, perfect, because then you've got your capnography and everything as well. But if you're ever stuck with how to monitor a rabbit, if you've got a Doppler, I wet with gel a little bit on their chest and tape the Doppler to the side of their chest, because then you can actually hear their heart rate and you don't have to fanny around with getting under the drapes to get your stethoscope in there, because it's a pain in the arse. Just tape the Doppler to them and you consistently know that they're okay. So that's one thing that I do. It really helps.
I like that. Good. I've never heard that. Yeah.
So, and you get to do the little heartbeat dance as well, because everyone in the room can hear it.
Is it quite ravey? It's probably quite fast, isn't it?
Very ravey. Doosh, doosh, doosh. Yeah. So, yeah, I think sort of going back to why we might need to
By the way, could you take that on a femoral artery so that you're getting pulsatile, kind of more pulse-led rather than heartbeat?
Probably, yeah. Probably.
That would be a cool one as well.
Yeah. Okay. So I generally just do like a cross, and it keeps them steady as well. So, I mean, you might have them in like a tiny trough or something anyway, but it also helps if you tape it in across them, then it just helps them stay in one position as well. It seems to help. So there we go. Little top tip.
Yeah, I like it.
Yeah. It sounds like the consensus generally for rabbits, if they're not intended for breeding, is that they should usually be neutered. But do just have a chat think about the circumstance that you're in, the type of clinician you are, whether you do them very often, and do have a chat to owners about the risks. And I think there, again, isn't any evidence out there that says that delaying neutering in rabbits is beneficial for them. So it is sort of still suggested that neutering early is something that you could consider. I think the evidence out there for why you should do it is that there's some that says that it's easier to litter train them, it reduces aggression, spraying, it improves bonding, it prevents unwanted litters, obviously prevents pyometra, cystic endometrial hyperplasia, uterine adenocarcinoma. But the big risk is obviously your GA risk, and surgical complications like adhesions and stuff in your rabbits is really high. So you have to be super, super gentle with your handling. I think generally the recommendation out there at the moment is male rabbits to neuter between about 4 and 5 months of age, and rabbits between about 5 and 6 months. But I think it's just whenever you feel ready to, and whenever you think they're big enough. It depends what breed you've got as well, because if you've got a teeny tiny little breed, you're probably going to want to wait till things are a little bit bigger. But yeah, there's always going to be that risk. And along that line, like I was saying, you know, I'd feel much happier putting a rabbit under anaesthetic if I was going to put an ET tube in. Obviously, in things like guinea pigs, you don't often have that option. You're going to be masking. So I think that's why they generally say that neutering isn't really recommended in guinea pigs unless there's a specific reason. You can do it, definitely. But I think across the board, it's not something that you do for every guinea pig, because I think that risk is quite high, and we just can't we can't reduce it as much as we can for rabbits. I mean, is that what you do, or are you recommending neutering male guinea pigs? Or
going back to rabbits, by the way, I think that did you touch on this? But behaviour,
yeah.
I think a neutered female rabbit is going to be a much better pet than a not neutered female. And obviously, if you've got more than one rabbit, neutered animals are going to get on better, less fighting. So I think for me, it's the behaviour that's the big issue there. And often they're pets for kids, so you want the behaviour to be really good as well. And then otherwise you've got all that thumping. Is that the right word? Yeah. You know, all the thumping. I mean, that can be exacerbated. That can be super loud, can't it? I used to have a male rabbit. Like you'd hear it 3 doors away. So that was that. Guinea pigs. Yeah, definitely. Yeah, I wouldn't. Do you know what? When you talk about the guinea pig, I can't ever forget the hamster that was the out of hours emergency that had a pyometra, and it was like a £2,000 op. Anyway, that is a big thing to do to a hamster in terms of surgery. Yeah. And I was a little bit blown away that people even did it. But when I talked to staff, it was really interesting because it was 50-50. Half the staff were like, yeah, you should do it. And the other half were like, well, yeah, it's a hamster.
It's
would
difficult,
you offer
isn't it?
Yeah, as an emergency
I think I would offer it. I'd be surprised if an owner went for it, mainly because of the money versus anything else. But I don't know. I just think it's because, I mean, even like really good rabbit insurance, often they'll only cover you up to like £1,000. So anything over that, people are paying out of their pocket for. And I just think it's really unusual to find a person that's willing to pay a hell of a lot of money for a small furry, which is a shame. It is a shame, but also it is more risky. One, because the anaesthetic is risky, but also because you think with dogs and cats, we do it all day, every day. But how often has anybody ever done a hamster pyometra surgery? That's the thing. And that's the reality of it as well. Like it's more scary for the owner and for the pet and for us because we just don't do them. So
IV fluid bolus in a hamster?
Oh, God.
Where are you going with that? I mean, we're talking
microdose
like
it with an insulin syringe.
Do they do cannulas that are 62 or whatever?
It's crazy, isn't it?
The options you have available are limited.
Yeah. I mean, I've done a few like cystic ovarian guinea pig spays, and they're quite fun because the cystic ovaries are huge. Like you take them out and the guinea pig's like half the size that it was. But again, I think, and I've done quite a few guinea pig castrates. I think neutering male guinea pigs is maybe much more common. But I think
it's all fat, isn't it? It's all fat in that testicle. I remember doing my first one going, oh, they got such big balls. And then you're like, oh no, it's like 3/4 fat.
Yeah. Yeah, exactly. But yeah, again, I think that there's no common reproductive cancer that we see equivalent to uterine adenocarcinomas in rabbits in guinea pigs. So there's no real big reason to neuter them for that reason. I think that mainly it'd be for behavioural reasons or keeping a female guinea pig with a male that you'd maybe want to neuter a male guinea pig. But other than that, I think the only reason why I'd neuter a female would be if they got cystic ovarian disease, maybe, because I think the medical treatment doesn't really work that well. So, yeah.
Do you know what? We don't need more stress in our lives. I don't want to come in and have an ops list with a hamster spay, a guinea pig spay, and a rabbit spay all on the same day. No, thank you. Don't just leave the guinea pig and hamster alone.
I do dread the day when I get because I've had a couple of foreign bodies in rabbits that I know have needed to go to surgery, and the owners have never wanted to take them to surgery, but I am very worried about the day when they do. Because
what foreign body? You're talking a linear foreign body, like where they eat carpet fibre?
No. So often it's because they've eaten just normal food, but it just becomes really dehydrated. So it basically just becomes stuck in their gut, and so it's normal food that they would be eating, but for some reason it's just not very moist and it's not moved through. Weirdly, little top tip if anyone needs to do one, I was speaking to an exotic specialist and he was saying actually the majority of ones that you take to theatre, you can actually still milk out of the intestines rather than actually having to make an enterotomy incision. You sometimes can milk it through, but they often do need surgery. So I just dread the day that I need to because I'm really not looking forward to it. But
It's translucent, isn't it? Rabbit bowel. You're doing a Spain, you look at it, it's like this transparent paper. It's so
and I mean
so
they
thin.
can get horrendous complications post-op with adhesions and all that sort of stuff as well. I think I would only be neutering these guys if I felt really confident enough to, or the owners were super dedicated but know the risks. But yeah, and I guess the only one that's worth mentioning as well is ferrets, because obviously that changes things a little bit as well, doesn't it? And I think ferrets are actually a bit easier to neuter than your other sort of small furries. Have you ever done a ferret neuter? I don't think I've ever actually done. No, I've done one. I think I've done one ferret castrate and that's it. So we don't really see them that often, do we?
Must have done. Yeah, I must have done, because I remember the frequent smell that greets you when you come in.
Yeah.
I don't think there's an issue.
Yeah,
And the
I
mask,
think,
they put the whole head in the mask. I think I did.
Yeah.
Oh, actually, I don't think I was I can't remember if I was intubating or not. Or maybe I was. Yeah, I can't remember.
Yeah, but I mean, I think with ferrets, the thinking is slightly more like dogs, where it's a little bit more individualized and you sort of don't want to really early neuter them. But I think it's just, again, have a really contextualized discussion with the owners if you want to, because it's going to prevent breeding, it's going to prevent persistent estrus in females and that life-threatening issue they can have, reduce your sexual behaviors, etc. But they do say that traditional early neutering has been associated with increased risk of adrenal-associated endocrinopathy. For some of these reasons, people will delay neutering till they're a little bit older. So, or sometimes you can use those deslorenin implants instead, can't you?
Yeah, that's a good one.
Yeah.
Have you ever castrated a rat? Like, say you got two rats fighting, male rats. Is it just like anything else?
I think I've done one, but I can't remember. It was years ago.
Yeah. It's surprising it doesn't come up more often, isn't it?
Yeah.
Because, if you have two males and they're fighting, I don't know.
Yeah.
Maybe I suppose we just change the management.
I think a lot of people, though, that have a rat have one rat, like not multiple rats, no?
I guess so. Do you think? I think rats might be less popular now than they used to. I don't know if
I love them. They're my favourite small furry. I really like them. I'd get a rat over any other small furry any day. I think they're great.
I think I have a little problem with the tail, and I think guineas. I feel safer with guineas. I don't know. They're easier, aren't they? A rat, I feel like I do have to read what it's thinking all the time, whereas a guinea, just pick it up. Who cares? Pretty harmless, aren't they? Is that right?
No, I like a rat. I think they're funny, but. Anyway,
I do get where you're coming from, though. They're intelligent, aren't they? They've got a lot going on.
Yeah, they are. Yeah. So, but anyway, moving on from our sort of more routine stuff and our smallies, we wanted to sort of get a little bit vulnerable now and talk about some completely non-routine surgeries and maybe some issues that we've got ourselves into previously. I think the whole point of this podcast is obviously to open up discussions between GP vets and to make everyone feel that they're supported and, we've all been there, done that, got the t-shirt, it happens to everyone type thing. And to sort of emphasize that, we wanted to have a little chat about some cases that maybe haven't gone quite so well. So I don't know about you, Brendan, but there's been at least two cases that I can think of that I've looked back on now and thought, oh God, I wish I'd done that so differently. Or if I'd have known then what I know now, how different might that case have gone?
Yes, this is where I'm at. I was actually going through all these horrible thoughts in my head as you were talking. I didn't even... I was remembering my old boss, who is a wonderful lady. And she must have seen one of my dentals post-dental. And I assume it had some soreness in its mouth. I don't know. But she grabbed me when she was doing the second dental and said, look, here's a root. Left it behind in this, and I was like, I left a root behind. But I am a bit different from most people because I just kind of plod on through. I don't know. But how about you? Go on. What have you had?
I mean, probably the worst one that I will probably remember till I die was I hadn't long. I'd probably been qualified, I don't know, 2.5 years, something like that. And I hadn't long started as a sole charge ECC vet. And there was this big dog, I think it was like a Malamute type thing. It was 13, so it was an old Malamute. And it came in with a hemo abdomen and it was completely collapsed. I think it had about a heart rate of 180, 190 when it got there. It was panting like crazy, it looked sheet white, looked awful. Anyway, I had a really big chat with the owners. They weren't insured. I said, did some bloods, scanned it. There's loads of free fluid in its abdomen. Could see it had a cavitatory mass, but couldn't see where the mass was because it was so heavily panting and it was really deep chested. So I couldn't see whether it was splenic or whatever. No access to advanced imaging, just me and a nurse overnight, nobody else. I'd never auto-transfused anything before, and we didn't have any blood products in the practice. And to be honest, I didn't really know much about auto-transfusion. I used to just take them straight to theatre because I didn't know better. Anyway, they I spoke to them and said, this is a really old dog. It's, he's already got to the point where he's really struggling on his back legs, etc. Do you really want to consider surgery? Talk about all the risks. But no, we want to do everything. They consented up to like $5,500. Right, okay. Anyway, took this horrendously unstable dog into surgery. It survived through surgery, but I got in there, and to start off with, there was so much blood I couldn't see. I couldn't like make head or tail of what anything was. Managed to suction it all out, have a good look. And what I thought initially was the spleen that looked really irregular and was bleeding turned out to be a liver lobe that was bleeding. And there was me like, never even done a splenectomy on my own before. It's the liver that's bleeding. Definitely never done a liver lobectomy before. Called the owners and said, look, it's the liver. I can see the rest of the liver does not look normal. The spleen does not look normal. Are you sure you want me to carry on? They were like, absolutely, we want to save him, blah, blah, blah. So I was 2.5 years out on my own with a nurse at like 4 a.m. and
no
I did
coags,
a bloody
no vitamin K, probably.
Honestly, it was awful. I did a liver lobectomy. I don't know how I did it. I was trying to. It's awful. I would say
you can't ligate the vessels, can you?
Well,
there's nothing strong to get your
the thing was
onto.
The way that I can describe it is, like when you have a really deep chested dog and you're doing a bitch bay and you're having to break the suspensory blind, like right down deep in the chest.
Yeah.
It felt like I was tying off vessels and parts of the liver like that, blind, and just feeling my way because I couldn't bloody see. I had no big Balfour retractors. It was awful, absolutely awful. I was in theatre for about 5 hours, I think, managed to stop it bleeding, managed to get that bit of liver lobe off, and then did a splenectomy because the spleen looked horrendous as well. It made it through surgery. I still don't know how. I think I cried twice during surgery. It was awful. My nurse, bless her, was like, Charlotte. She was like, mate, if you don't do this, the dog's going to die, so you've got to do it. There's nobody else here with you. I was like, oh my God, what am I doing? Wow. Anyway, made it through surgery. It got into the kennel. I think I stayed about 2-3 hours late, making sure it was okay and doing all my notes. Anyway, handed it over to the day team and said, this is a really critical patient. I'm really worried about it. I don't know if it's going to bleed again. Don't know what his coags are doing, blah, blah, blah. And anyway, I came back down half hour later. There was nobody sitting with it and it had crashed. And it was DNR. And and you just think, God's sake. But it was awful. I will remember it till the day I die. But it's sometimes, and hindsight's a wonderful thing. Like now if I got a case like that, I'd tap it, I'd check it, whether it was just a full hemo abdomen or whether there was something else going on. I'd auto-transfuse it, I'd stabilise it, and then wait for the surgeons to get there in the morning to be like, can you deal with this? It might be the liver. Because it's, I just never want to get myself in that sort of situation again. But where I worked then, I didn't really have that as an option. And I had nobody that worked during the day was any better at surgery than I was. So it was sort of do or die, really. It was awful. And I will remember that. I would take that to my grave, probably. But I don't know whether many people ever have surgery stories like that. But it's horrible. It's really, really awful if you get yourself into a situation like that. It's horrendous.
I don't know. Oftentimes you're preparing, you see, at least in an emergency, you can pave the way for issues. Because if that patient had died, it's a different context, isn't it? It's already bled loads. It's 13. Who knows? Yeah. It's when like more routine things go wrong, isn't it? This going back 23 years, but I had a cat spay roughly. So don't want to imply where I was. I had a cat spay that had woke up seemingly with brain injury.
No way.
So yeah, it recovered, and it was like it wasn't there. It'd sit up and look at you, but it wouldn't really move very much, and it would just be in a slight daze, like it was subnormal. Yeah, it's really weird. And in those days, it stayed in our kennel overnight. This sounds terrible. My God, I don't know if I should say this. I'll say it, and you decide whether we're going to keep it in. I was testing its like brain function with it because it was kind of odd because it was kind of normal, kind of not. But for some reason, the only thing I had was a pepperoni. So I had a slice of pepperoni, and I was like, "Look, no, it's not like noticing anything to do with the pepperoni at all." So then, right, because it didn't seem to notice the pepperoni, smell it, look at it, or anything, I put the pepperoni slice on its head, on her head, and because she wasn't moving very much. And in the morning, it was still on her head. I'm so weird. I'm so weird. I don't know why I did that. I look back and I think, what? I'm just mental. Anyway, and then me being like so open and without any filter. So I think I said to the client, and I put a pepperoni slice on her head and it was still there in the morning. So I really don't think she's with it.
Yeah, yeah. I mean,
No.
like things used to be so different, didn't they? I mean, even like you hear about most practices now where everyone has to have a dedicated out of hours service, right? So the majority of people, if they need something to stay in overnight, will ship it to an out of hours service. But some places will still say, "Oh, we can keep them here overnight on fluids. There's just nobody in the building." Oh, I'm a little bit worried about. But I mean, there's been places that I've heard of that have done that, and then you come back to a dead animal in the morning, and it's just awful, isn't it? Like, it can still happen. I think if you've got informed consent and people understand that there's a risk, then obviously it's different. But yeah, there's a lot of stuff that you'd look back and you think, oh my God, if we'd have done that again now, like things would be very, very different. It's crazy, isn't it?
Yeah. It's to do with people's expectation as well, I suppose, and what's
Mm.
available and stuff. But then, do you know what? Right now, it's a really horrible situation because there is a whole swathe of clients that can't afford the out of hours care. A huge amount, isn't there? Do you remember how many times you'll see a case coming in the night and the GP practices have left the cannula in because they couldn't afford the out of hours, but then they're going back to the GP vet the next day, but then they've kind of got worse overnight and then come to you. I do think, yes, it's great. We've got really good care, but at a price, and there's no option for, I don't know what percentage of the client population, but I'd say at least a quarter, if not a third.
We need to talk about these things because you only learn from mistakes that you make in cases that you've had. So it's, anyway, lessons learned, lots of lessons learned.
I had a complaint about using cephalexin in a kidney disease cat, I think it was, years ago this. And the guy had read that cephalosporins are contraindicated in renal disease, I believe.
Okay.
I remember. And I think I had it on like that back in those days. We used to do Metacam at this for stable, cardiovascularly stable patients seemed deemed okay at kind of, it's like one drop. We didn't have the Metacam cat. We used to do one drop once a day or something. So it's a super low dose. So it was a very well thought out kind of rationale I had. And I was aware of cephalosporin kind of, some kind of comment about kidney disease, but it felt like it was kind of quite mild. But anyway, I ended up with a complaint, and that was it just does your confidence in. It makes you feel shit. And it also makes you feel, you start treating clients differently because you're feeling more defensive and you're feeling like they're there to attack. Or you start forming a wall between you and the client, which I think ultimately doesn't help you. My boss was pretty good at the time, to be fair. But yeah, have I got that right about cephalosporins and renal disease?
So I think I just had a quick look on it now again, and it says it's not contraindicated, but you do have to be careful and maybe lower your doses because it's primarily renally excreted. So I think that's why you'd be a bit careful, but it wouldn't say it's completely contraindicated. So anyway, but I remember I had one, this will probably get me not into trouble, but I bet you loads of people will shout at me. There was a guy that came in who had no money that came in with a Frenchie who he didn't mean to get pregnant. It just got pregnant. He had
with
no
a Frenchie,
idea.
obviously.
He had no idea when. Yeah, he had no idea when it was mated. It could have been mated anywhere in between this 2-week period. Came in, she had black discharge from her vulva. She was completely fine in herself. Anyway, he managed to scrape together the money for the consult and for me to do a quick POCUS scan. And the puppies were all in, their heartbeats were all still okay. Everything was way over 180. So I was like, well, they're not currently stressed. But I said, the fact that you're getting this discharge now tells me that she probably needs to have them pretty soon and she's not contracting at all. She had no Ferguson's or anything. So basically sort of said to him, look, you've got a couple of options. I can either do a C-section, but I've got no idea how viable the puppies are going to be because the thing is I've got no idea how long it's been since she's been mated. Are you at 63 days? Who bloody knows? It might be 2 weeks before that, might be bang on. So I said, I've got no idea whether it's the right thing to do or not because you can't even tell me how old they are. I said, this was like a Sunday morning at like 5 a.m. I said, there might be some other practices that can potentially do a C-section cheaper. I was like, mum's not distressed yet. But I said, the thing that I don't want to do is I don't want to start giving her oxytocin because if she gets a puppy stuck, which she's very likely to do, I can't take her to C-section knowing that you have absolutely no money to be able to pay me anything else from here now. Like you're never going to be able to afford the out of hours fees. It's 5 a.m. on a Sunday morning. There will be some practices open that might be able to do payment plans or make it cheaper or whatever. And anyway, he went mental and started like shouting and screaming and spitting in my face. And I think that I'm surprised it didn't turn into a complaint, but I thought it would have done. But again, you always have these cases that you think maybe I'd deal with it a bit differently now, but I don't know. He was just a typical not very nice person anyway, which meant that I could only really deal with it in one way. But not very nice.
Sometimes, I've been short with them in situations as well. And then the problem is if you don't have infinite compassion and infinite patience and infinite tolerance of them being annoying, and then you just let yourself rise to it, it doesn't help, does it? That's the problem. And I've done it too, and as well. It's so hard though to be, especially when you're doing night work and it's it's exhausting. And
I mean, I think that was at the point where I was trying to be as compassionate as I could. It was like 5 a.m. I think it was at the end of my run of like 3 or 4 shifts in a row, and these were like 15-hour shifts as well. They were long shifts. I think I had a dyspneic patient and 2 or 3 other quite critical patients in the back, and it was only me and a nurse, and he wasn't particularly nice, this guy, so I didn't really feel that confident being left on my own. So we were having to leave the patients to be around him, which made things really difficult. And he ended up getting to the point and was like, he said, so you're going to let my dog die because I don't have the money to pay? And I never lose my patience with clients, never. This is the one time I have. And I was like, I'm really sorry. I said, it's not me that's letting your dog die. You bred her when you knew you couldn't afford it if anything changed. You don't have any of the information to give me to tell me whether it's right to do a C-section or not. I said, she is your property by law. She is your animal. You have a responsibility. It is not my fault if something happens to her. I've given you all the options I can. Please go away. Basically, because that's
pretty fair.
But what are you supposed to do? But then some people will still say, well, it's my fault because I didn't take her to C-section because he had no money. I think that's what the public sometimes don't understand, is that when we have people screaming at us saying, you're going to let my pet die, and you feel like it's your fault, but actually it's not me that bred that dog. It's not me that didn't save up the money to deal with something when something happened. It's, you're breeding a French bulldog. Something's going to go wrong. Anyway. But there we go.
Let's be honest. He's breeding the French bulldog, nothing to do with the dog's welfare and everything to do with the money he's going to sell them for.
He didn't care.
Let's be honest.
No. He was not a very nice man. And then he also said, do you know what I also said? I said, I even Googled and looked at practices that were open that were nearby. And I said, there's even this practice nearby. I said, it's about half an hour away. I said, I think I know that they do payment plans. They're open from 8 a.m. this morning on a Sunday. No, 9 a.m. Sorry, on a Sunday. I was like, that's amazing. I said, why don't you go there in the morning? He went, well, I don't have a car. How is that my problem? I said, well, why don't you get a taxi? And he went, you're expecting me to pay for a taxi? And I was like, well, what do you think I'm going to do? I'm not going to drive you.
God.
Anyway.
Wow. So, you did well. I'm with you. Yes. Tell him. That is very common, that type of consult, though. I think, do you think the tide is turning on the Frenchie breeding? Is it going a little bit less common now?
I think it is getting better. It is getting better slowly. Yeah, I'm definitely not seeing anywhere near as many pugs as I used to. Pugs are definitely declining.
Wow.
But I think Frenchies, I still see quite a lot of them. But I think maybe people are realising quite how many issues they have now because they've owned a Frenchie from a pup and then realised how many problems they've gone through as it's got older. So I don't know. Anyway.
Yeah, so how is it that vets are cruel or whatever when they're perpetuating a breed that has so many health issues, so they can get money? Yeah, it's always back on us. It's back on us.
I know.
Aren't you terrible, Charlotte, for not bankrupting the practice by... And the problem is, if these were I think we've had people on social media going, well, you just do it free of charge, don't you? But they're working in practices where that is a once every 3-year event. In out-of-hours emergency, that is a once every shift, even twice in certain clinics. You can't, and then we haven't got the manpower to do that and look after all the other patients. And if you did it on a nightly basis, that is not going to be feasible for the business if you're doing it free of charge on a nightly basis. Your bosses and it ain't going to work. So people have to understand we've got different situations here, haven't we? Out-of-hours emergency is very different to general practice with the odd client.
I mean, where I was working, if I'd have known that he'd have been able to cover the cost, like the actual physical costs of doing that surgery. So if he had, I don't know, 600, 700 quid, where I was like, do you know what? That will mean that we won't be going into the negative by helping him. Then sometimes you're a bit like, well, do you know what? If we don't get the rest of the money back, it's not the end of the world. But when someone comes in and says they have nothing, all of the consumables, all the ISO, all the drugs, all the everything is coming out of someone's pocket. And it's tricky, isn't it? There's got to be a halfway house somewhere. But anyway.
We do take a lot of emotional. We had a really emotional case where it was a cat that was about 14 years old, not really old at all, losing weight. And I really felt like I could have fixed her, and also took an immediate, genuine affection to her. Like I saw her, she came out. I've got this really cool windowsill thing going on. It's a white windowsill, and I put a little cardboard box at the end with a lovely vet bed. And because I thought I'm going to examine the cat on one side of the windowsill where the weighing scales were, and then if they want to get away from me, they can go along the windowsill into the little cardboard box. So I can still examine them, because it didn't. And she loved it, and she was like in the porch area of the cardboard box, just on the bed, just sitting there on the windowsill. She was lovely, but the clients had minimal funds, and it's dental disease. That was it. I don't know how much to say. And then, but they didn't have the funds. And I ended up putting her to sleep. And, whoa, what can you do? It was because it was an older cat too. We would have if she was younger, I think we could have done something different. Like we could have come up with, I don't know, charity, raise money, whatever, and just done things. But because I think she's actually near 15 or 16, I thought this doesn't feel like the right situation to do something free of charge, or because there could easily be concurrent problems. I'd blood test, and I didn't want to drag things out for the owner, if there's early kidney disease or something.
Yeah, exactly. There's never a right or wrong thing, and I think sometimes we do look back and wish we'd managed things differently, but ultimately these are the cases that we all see every day, and it's what makes our profession so amazing but so difficult. And why so many people leave, why so many people think all it takes really is to have a few of those kind of cases in a row to make people feel like they don't want to do it anymore. I mean, I had a run a couple of years ago, I had a run of septic cases where I think I had about 5 in 2 weeks, and I lost every single one of them. It was awful. And I got to a point, and I had to have like a bit of a mental health break to say, I don't know if I can do this anymore, because it's when you invest so much time and effort into these animals and they're so obviously struggling, and you still lose them anyway, or the owners decide to call it quits or whatever, which is completely fair enough. It's hard graft. It's hard going. Yeah, it's not always easy.
The best example I have of that is when I was in a clinic anyway, and we had a RTA dog that had been in hospital for 5 weeks, and there came a point, it had multiple issues: cardiac, pelvic fractures, really difficult pain management, all these things, non-ambulatory, and we realised it had been being checked every hour because it was so critical for 5 or 6 weeks. So we realised the dog had never slept for 3 hours because it's been checked. It's critical patient for that long. And one of my colleagues was like crying because she was like, I don't know if we're doing the right thing. It's that kind of thing, isn't it? You're putting the dog, the owner, through so much, and especially at 5 weeks or whatever, you're like, crikey, this is awful. Do you know what though? 2 months down, dog was discharged and could walk around and was doing fairly well. But that, as vets, that we're carrying the pressure of the decisions, aren't we? And that was, I so empathized and felt that pain that she had, and I still think of it now. I think it's a really good example of, are we doing the right thing? And we don't know. We don't know how it's going to end, do we? And that's you with the septic patients.
Yeah, well, you think as well, animals that are in the hospital with us for even a couple of weeks, you think of that percentage of their life that they're in hospital, that'd be like a person being in hospital for months and months, but with a person's consent, whereas that animal is probably like, oh, bloody hell, I don't really want to do this anymore. But it's that ethical dilemma of when do you stop? When is it too much? But yeah, I don't know. There have been a few cases that I've dealt with that I've thought, I don't know if this was mine, whether I would have kept going. But, it's hard because it's so individual to every client, every animal. But you can only do what you can do.
Yeah, I think some vets find this easier, but I suspect that's because they haven't seen the other side of it, which is when I've worked with really, really effective emergency critical care and internal medic people that have fixed things that I would have, when I was younger vet, I'd have just gone, nah, that's not going to make it, euthanize that. And then you see them fix it. And then that's when you start getting into these difficult things like, crikey, do we fix it or not? Because actually I've seen vets, they've turned similar cases around.
Yeah.
But it's self-fulfilling if you don't, if you never do that and you always put them to sleep, you don't know.
I think it depends on the type of vet you are as well. Like, I feel like I'm quite a pragmatic person and will always say to my owners, I use the phrase a lot of the time, just because we can do something doesn't mean we always should. And I think it's that contextualized care thing, isn't it? It's, you've got all these options. I'm not saying that it's right or wrong, but they are the options to you. If you decide not to do them, it's not the wrong thing. Moving on to something a little bit different anyway. And following on from our RVN episode in May, we chatted to a lovely lady called Jackie, who reached out to us about something super exciting.
Yeah, she was super interesting. Anyone who might be interested in doing some charity work, going abroad and doing some charity work, and just such a great thing to do at least once in your life. I think everyone should do something like that. So Jackie has started an amazing charity called UK Vet Nurses Worldwide, where she works to educate different animal centres around the world about the best anaesthesia and analgesia practices, and among other things, recruiting the help of some of our amazing UK RVNs.
Yeah, have a little listen to our chat with her now to find out a bit more. Okay, so we've got Jackie on the podcast with us today. Thank you very much for joining us.
Thanks for having me.
You're so welcome. So for anybody who might not know who you are, do you want to give us a little bit of a spiel about who you are and what you do and your charity?
Yeah, so my name is Jackie and I am the founder of UK Vet Nurses Worldwide, and we are a charity that sends out vet nurses and vets. Vets come with us as well. And we go around to places around the world training people that don't have our level of training, and we train in all sorts: anaesthetics, dressings, wounds, buckets, anything that they need help with. And we go over there and help them with that.
Can you tell us a little bit, just briefly, how it all happened?
How it happened is I went to Romania with a vet, and I went over there to help her film her learning platform for Brady Care. And I just noticed that a lot of people just didn't have the resources that we had at home. And just with a few tweaks of drug protocols or the anaesthetic circuits or anything along on that sort of scale had such a massive impact, certainly for the dogs and the staff. It's so much less stressful when it goes easier. So yeah, I just noticed that just a little bit of nursing tweaks had a massive impact. And so that's how it started, really. I just noticed that there was a need for training, and that's how it got going.
Now you've expanded to loads of countries.
So from Romania, I've been to Romania quite a lot at the Centre of Hope, and they're brilliant there, and they just sort of absorb all the information and work really well with it. But from there, I was asked to go to Sri Lanka, and I went to Sri Lanka, the Dog Star Foundation, and I've been there a couple of times now and helped with their vets training in the anaesthetic protocols and stuff like that. But yeah, I've been to Greece, Spain. We're going to India in September for Manali Strays. And we've been asked to go to the Horse and Donkey Trust in Gambia next year as well. I get requests a lot, but because we're a small charity at the moment, I can't do everything. But eventually we're going to expand, and I can send nurses out without having to be there myself, and we'll have a little team going. And yeah, that's the plan anyway.
So how long has it been running for now? How long have you been doing this for?
About 2 years now.
Oh, wow.
So yeah, it's gone quite crazy actually, because there is a massive need for this. I think what we see is a lot of vets go out, and obviously vets are great. We need them to do the surgeries and neutering and stuff. But no one really seems to highlight the fact that the people helping with these, like the anaesthetics or the sedation or just the drug protocols, it's really needed, mainly for animal welfare, because some of these dogs are waking up during bitch bays or operations. Some of them are not waking up, and just with a bit of training, it's such a huge impact for these dogs. They get the proper pain relief, they get proper anaesthetics, and they get proper care. And these people really, really want to do that. They just haven't had the training that we've had. It's just a massive need for it. Really?
I mean, I know I heard from one of my friends when we were at uni, they went out and did a neutering clinic in, I can't remember where it was now. And it was run by this amazing vet who had basically set up this whole charity and was basically being a nurse for all these vet students that were going out and doing all these neuterings.
Yeah.
But you just think that's crazy. They'd sometimes have 4 or 5 bitches on the table at the same time, and one person would be running between them like anything.
Oh, yeah,
and you just think there is such a need for RVNs to be out in those places, training people, getting more feet on the ground. Absolutely massive. And it makes a huge difference, doesn't it?
Massive difference. And even in the knowledge in some of the dogs, some of the places don't have the drugs that we have. They have to make do with what they have, and sometimes the dogs take a little while to wake up, or their blood pressure is really low, and just say, well, we'll pop them on fluids for a bit, get the blood pressure up. It makes such a huge difference. Like I said, with the dog, I've had about 9 bitch spays all lined up on one table, and just me going along these dogs. It's like, But it works. It works really well. And like I said, with the training with the proper drug protocol, it works. And these places, they're brilliant at just trying to learn a bit more. I went to a Dogs Trust conference in Cyprus. And I felt like everyone kept coming up and they're just like, oh my God, you're a vet nurse. We need you. It's just like, and they're just like, we need your training. The only training that we have is on YouTube. So it's just such a massive need for nursing. I really want to raise awareness for that. And I want to raise awareness for how, our profession is a profession that's needed and is a profession that is not, it's not thought about enough. And we really need to, we're vet nurses, we're professionals, and we really need to push that, really.
Yeah, I was just thinking, there's so many nurses I've spoken to in general practice that would love to go abroad and stuff.
Yeah.
But there's a few barriers. I mean, number one, everything's done very differently. The drugs are going to be very different.
Yeah.
So there's going to be a whole load of... How much do you need nurses right now too? Or is it more just awareness of what your charity's doing?
See, I put the post on my social media when I'm going to places, and I have a lot of nurses commenting. So I have a lot of nurses wanting to come, and you find a lot of these nurses want to go to these places but don't want to go on their own. So that's another thing. We go as a group. There's 10 of us going to India. It's more awareness to get, like I said, I'm sponsored by NutriVet and they've been brilliant and they really helped me. And they even sponsored me before my charity was registered, which is a massive faith in my work, really. So that's, but they really help with the travel side of things and support. So it's more the support that I need as well. And if there's any more sponsors out there that want to, I think this would be a really good opportunity for corporates or something along those lines that have that funding and want to show off what vet nurses can do. But then they're also backing animal welfare and their nurses, and the nurses can come out with me and they can learn a whole different side of nursing, because it's, like you said, it's completely different. You have to go out there and not expect UK standard. You go out there and you have to work with what you got. You basically okay, this is it. This is what we're going to do. And it makes you remember why you became a vet nurse. And it's great. I go out there and I'm buzzing. It's just, and you see just such a simple step makes a massive knock-on effect for these animals and these people. And it's great. And that's why you remember it. That's why I became a nurse in the first place.
Obviously, everything's going to be super different in a charity setting anyway, compared to even normal UK vet practice. But are you doing total intravenous anesthetic? I take it you have no monitoring equipment, just a stethoscope in yourself half the time?
Some places do. Romania has gas anesthetic,
Cool.
but they're not that trained in it, so they don't tend to use it. So,
okay.
And before the protocols were, a lot of people do a lot of, the intravenous top-ups and stuff like that. A lot just use heavy sedation, and sometimes that it's just not enough. It's not long enough. We've trained them with propofol top-ups and stuff, which is a much safer way of keeping them asleep rather than keep topping up with a load of cocktails of drugs that are not working, basically, and just lower the blood pressure, lower the heart rate, and it gets a bit sketchy then. So yeah, we train them in that way. A lot of places can seem to get hold of propofol, so we use that a lot. And then obviously it's the pain relief, which is really important as well. But it's an eye-opener, and sometimes you get to a place and you're like, what am I going to do here? And then just tweak things. But I love that. You get kept on your toes and you work out the best way for these animals. Obviously, it's always, you're working with other charities. It's a money thing, and they have to use what they can afford or what they can get hold of. So yeah, so there's a lot of research going on and a lot of tweaking, but it works really well.
So you're on social media? How do people find you? Is there a Facebook group or?
Yeah, so it's UK Vet Nurses Worldwide, and we're on Facebook, TikTok, Instagram. We've got a website as well. So we're all over the place. We're there. So yeah, we're doing really well with that. It's grown a lot, particularly in the last 6 months. It's grown a lot. So yeah, we're just getting more awareness out is always helpful.
Cool. Oh, well, thank you so much, Jackie, for coming on board. We really appreciate it. And fingers crossed we'll have loads of people listening that will go, that sounds really interesting, and be clicking on your links.
Thank you very much.
Thank you so much to Jackie for coming on the podcast to chat with us. She was lovely, wasn't she?
Yeah, she was. Super interesting prospect for anyone interested in doing some charity work. So we'll put some links in the show notes, and anyone's interested, you know how to get in touch.
Yeah, great. And before we finish up for the day, we just wanted to have one final chat about something we seem to be seeing a bit more of in practice. And Brendan, you mentioned that you've had a couple of cases of these in the last couple of months, haven't you?
This is big news for everyone in GP and emergency work. I think I've caused this to happen because I vaguely think we talked about rodenticides, and I was basically like, well, you never see vitamin D. It's all vitamin K, isn't it? And then literally after that, I've had 2 vitamin D ones. In fact, 3 altogether. So vitamin D rodenticides are now getting quite popular. Both the clients bought them off Amazon. So I don't know if they're just suddenly like being promoted on Amazon or they've had good reviews or something. But these were both farmers and they're using vitamin D rodenticides. And I think in fairness to farmers, they do seem to have a habit of leaving them not in the tubes, so dogs can access them. And maybe because they're using so much, I don't know what the reason is behind it, or cost or practicalities. But so yeah, and they get sky high calcium off the scale. One case had symptoms for 2 or 3 weeks.
Whoa.
And I blood tested, the creatinine was, I don't know, roughly 300. I'm going to have to work out what this is in American units one day. And so basically mild to moderately elevated, but the total calcium was high off the scale. I think the phosphorus was like normal-ish. So yeah, but they both went off to the RVC for referral and management because of I think people use bisphosphonates, some kind of vague kind of controls that we can't use.
Yeah.
Yeah.
I think,
have you come across these?
Yeah, I think basically if you get them, I mean, definitely seek referral advice if you get one because they're not common cases. But I think like long and short of it is if you know that they've had it recently, so much like your normal toxins, try and decontaminate, so induce vomiting, give activated charcoal if you know they've had it really recently. Generally for these guys, they use saline rather than Hartmann's, so you want to put them on IV fluids quite quickly. Check that even though you've got your total calcium, check your ionized calcium is high as well to see exactly what that is. And then sometimes you can give things like steroids and you can give diuretics like furosemide to help as well, bisphosphonates. But you really need to be monitoring ionized calcium and phosphorus really, really closely and keep an eye on those kidneys. So yeah, it's a hospital jobby really. It's something that I'd be referring to somewhere where you can give them 24/7 care, ideally. They're not very easy cases, especially if it's been going on for a while. But yeah, I think they are becoming a little bit more common.
Yeah, the historic ones that used to be really popular was the psoriasis cream, Dovinex, where the dogs love the flavour of it. And I had one lovely man who used to put it on his legs and the dog used to lick it off his legs, but they'll often get the whole tube and they're critical as well. And often the younger patients, and I've referred both, one lived, one died, and they're nothing like a vitamin K where we've got an antidote. So if anyone was asking for advice, I know we've got, it sounds like there's more resistance to vitamin K, but it's so much safer in a pet context, isn't it?
Yeah, definitely. So there we go. I think, again, it's one of those, so like we chatted about in our last 2 week takedown, remember we have partnered with Vet Shadow. So if you ever do get a case like this where you think actually it would be really nice to get some specialist advice or some help, you don't really know what to do from the get-go, that's where people like Vet Shadow can really come in. They can give you a bit of advice over the phone, help you out. So again, if you do want to have a think about using a service like that, the link will be in the show notes again. So please do have a little check if you think you would be interested as a practice.
Yep. So roundup time. I think we've got covered loads, from neutering cats, small furries, awful situations you never want to be in surgery, to sending in RVNs abroad. Makes it sound like we're punishing them. Send them abroad for charity work, and much more.
Yeah, we hope as ever you enjoyed listening, and remember to get in touch if you have any comments or suggestions to help us improve these pods for you, any topics you particularly want to cover, etc. And remember, you've got the blog, you've got our WhatsApp number and the socials to contact us through. So please do get in touch.
Absolutely. But for now, thank you for listening. Next Sunday is our day of rest, but join us again for our next 2 week takedown in 2 weeks' time, where we will be talking in depth about a very exciting new diagnostic tool that comes to the market, all to be revealed soon.
Yeah, we're looking forward to it already. Until then, it's bye from me.
And bye from me. Take care. This podcast is intended for licensed veterinary professionals and is provided for educational and discussion purposes only. Whilst it's publicly accessible, it is not intended as advice for pet owners.
The views shared are based on our own clinical experience and interpretation and do not replace individual clinical judgment. We accept no responsibility for decisions made based on this content, and all cases should be assessed on an individual basis.
Any references to medications, treatments, or products are made for educational discussion only and are not intended to promote or advertise veterinary medicines to the general public. Veterinary medicine should only be used under the direction of a prescribing veterinary surgeon and in accordance with the UK veterinary medicine regulations.
This podcast may include paid partnerships or sponsorships. These do not influence our clinical opinions, and any sponsored content will be clearly identified.